about Charlie's story. Some of you might have a little bit of an idea of who Charlie is, and some of you might not, but that is Charlie. He has a very unique story, so Sarah and I will be talking about him. My name is Elaina Guenther. I work in the registration office. I'm the graduation audit coordinator, so I definitely recognize some of your faces, and if you're a senior, I really hope I recognize your face. I'm also an alumni. I graduated in 2015 and I'm currently working on my master's here. I have 5 siblings and I became an aunt at the age of 13, so I was pretty young. I've always been surrounded by babies because of that. We've added about 8 more to the family, so I have 9 nieces and nephews. I grew up really close to my siblings, and so naturally I grew up really close to my nieces and nephews, and they mean everything to me. People talk about the love for a child, and I feel like my love for my nieces and nephews is as close as I'm going to feel to that. So my brother Justin, he is an alumni here as well, and so is his wife Sarah. So last year they told us that they were pregnant with their second child. They already had one. His name is Theo, and we were so excited to have another baby in the family. My other sister-in-law was pregnant at the time and due in November, so I was thinking this was perfect timing because right about the time that new baby was going to be out of the newborn stage, we were going to have another newborn, and newborn cuddles are the best, so I was excited we were going to have one right after another. So I thought everything was going to be perfect with that. So on Thanksgiving night last year, I was staying the night at my parents' house and I was already in bed, and then I got a knock on the door and my mom came rushing in. I was like, this is very weird, like she does not do that, we have boundaries. And I looked down and Theo was there. I was like, that's weird, Theo was not here when I went to bed. And I looked up and my mom said Sarah was experiencing some bleeding and Justin rushed her to the hospital. And I jumped out of bed, we went downstairs, sat with my parents and started playing with Theo, and I just remember being really confused. I never once thought that there would be something to go wrong in the pregnancy. I'm the type of person where you know of the first 12 weeks are kind of that iffy stage, but after the 12 weeks, that's usually when you tell people. Sarah was way past the 12 weeks, so it never once crossed my mind that there would be any kind of issue. I was really nervous, and I started texting some friends, some close friends to pray for us, and I was praying. And then Sarah and Justin came home, and everything was fine. They said that the doctor said it was normal, that a lot of women experience this, and everything was okay. And so I just remember thanking God and just thinking, okay, we're fine, it was a little fluke, and we're okay, and we can get back to our normal life and a normal pregnancy, ideally. And then a few weeks later, I got another call, and that's kind of when everything changed. So this is where I'll let Sarah take over and kind of tell her side of the story and all the events that followed after that phone call. So, if you wouldn't mind welcoming my sister-in-law and best friend, Sarah.
This is Charlie.
He's
much bigger now. Yeah, happy ending. All right. Well, hello everybody. As Elaina said, my name is Sarah. I graduated here in 2013. My husband's name is Justin, and he graduated in 2012. We got married, we had a son, Theodore, he's almost 4 now, and we decided when he was about 2.5, we wanted to start and add to our family, so that way there would be about a 3 years age difference between the 2 kids. My husband is a credit analyst at Community Choice Credit Union. I work at U of M, the hospital, in the chemical pathology laboratory as a lab tech. So in August, as Elaina said, I'm going to touch kind of on some of the things she already mentioned, so sorry about the repetition. But in August, we found out we were pregnant, and the baby was going to be due at the end of April. And we were really excited because the plan seemed to be working as we wanted it to. But this pregnancy was a little harder on me. I was experiencing a lot of morning sickness, a lot of nausea just all the time. And it was just a lot different than my pregnancy with Theo. Sorry, also, is there like a clicker or something? There's this button.
Yeah.
Here's some pictures of us, our family. There's Theodore. He loves trains. So, and then that's when I was pregnant. That was actually just a few, like maybe a week before I delivered. So there was our little family before Charlie came along. Let's see. So I was really uncomfortable all the time in my pregnancy, especially when the baby started to grow. And then on Thanksgiving night, as Elaina said, after all of our family gatherings, we got home and I was experiencing a lot of bleeding and I freaked out. So we went to the hospital, dropped Theo off first, and you know, they checked everything out, said everything looked normal, and it put my mind at ease for a while. But the bleeding continued, and I started to worry some more. But the Monday after the holiday, we found out we were having a boy, which I was really excited because I wanted 2 boys and then to call it quits. So it was still, everything was kind of going according to plan, apart from the bleeding. So then fast forward to December 17th, it was 5:30 a.m. I woke up to go to the bathroom, because of course I was always in the bathroom, and I felt contractions, and they weren't the Braxton Hicks contractions that are just like fake ones that don't hurt, you know, you just feel your stomach tightening. I felt discomfort and pain in my back, and it wasn't the first time I've had these, so I knew what was going on, and I called the triage center at the hospital and told them what was happening. They said I could come to the hospital if I wanted to. So, of course, we went. Once we got to the hospital, the nurses hooked me up to the machine so they could monitor me and the baby. And they all were pretty surprised. And they're like, wow, you are having contractions. Like, they didn't believe it. So, it made sense because they wouldn't, you know, nobody's thinking an almost 22-week woman is going to be having contractions. So after they saw the signs of labor, they asked if I would stay overnight so they could monitor me, but I could go home if I wanted to, which was ridiculous. So of course I stayed. So I continued to have the contractions the rest of the day. They started to get more uncomfortable. And then it was Sunday on that day, so I wouldn't be able to see regular staff or get an ultrasound until the next day. Excuse me. So the night was very long. I didn't get a lot of sleep with all the contractions and the pain. And the next day they scheduled me for an ultrasound. And it showed that my cervix had started to shorten, which is a sign of labor. So, and it was much shorter than the ultrasound I had 2 weeks prior when they found out that I was having a boy. So this was the sign that I was getting ready for delivery. And then after we found this out, 2 neonatologists came in to speak with me. And they explained that the age of viability is 24 weeks. So babies born before that gestation didn't have much chance of survival, especially 22-week babies. They had seen 23-week babies before, but typically their quality of life is not very good. They have lots of medical problems, learning disabilities, physical disabilities. So point blank, they said if I delivered within the week, my baby would not survive. And they wanted me to stay on bed rest until April, which if you remember, it's December 18th at this point, that's 4.5 months away, which is not very realistic. But ultimately they wanted to get me to 25 weeks, so they wanted me at least to stay in the hospital for 3 more weeks. They told me that babies are incredibly small when they're born that early, and their airways are extremely tiny. And due to their lungs being so underdeveloped, he would need a breathing tube. And most babies his age, we'll say, the 22 weeks, their airways are so small that the smallest breathing tube they have usually doesn't fit down their throats. So I was devastated, obviously. I stayed as composed as I could, but I was really just like in a haze when they were explaining all this to me. And you know, they explained so much information to me, like more than I could comprehend at the time, and then they asked me to make a decision. They said I could choose not to be pregnant anymore. That's how they worded it. They said I was still early enough to terminate the pregnancy if I wanted to, so that was my first option. Second option, if I delivered within the week, they could hand my baby to me and we could let him pass while I hold him, which seemed so cruel because if he couldn't breathe on his own, he would just be suffocating until he died in my arms. So that was their second offer. And the last option, they said they could do everything in their power to keep him alive. And they said even though they would try, due to his size and underdevelopment, he might not make it just despite their efforts. So they were preparing me for the worst, and I understood, and I could understand that. They were the professionals, they had seen stuff like this all the time that just had sad and horrible outcomes. So I cried that night and I called out to God and I just kept repeating, God, please help my baby, help me and save my baby. I had contractions the entire day, even when the doctors were telling me all those awful predictions and their possible solutions. They got worse at night and started to become very painful, so I couldn't sleep. They were becoming unbearable, and I kept calling the nurse and telling her my contractions went from 2 minutes to 1 minute, and I couldn't tolerate the pain. And she just kept telling me to relax and let her know if I needed Tylenol. So I asked her, so I asked for the doctor, and she came in around 4 a.m. and she said they didn't want to check to see if I was dilated because I was still bleeding so heavily and they didn't want to mess with me more than necessary. But I told her I needed her to. I really wanted her to. So I was laying back while they were checking me, and I wasn't able to see the surprised look on her face when she mouthed the word 5 to the nurse, but my husband Justin saw it. So they sat me up, and the doctor's face went from, all business to pity at that point, and she told me that I was dilated to a 5. So I couldn't hold it in anymore. I just kept crying for my unborn son, who was going to come into this world way too soon, and I could not calm down. And if they say that when you're having contractions, you're supposed to relax your body so the contractions pass faster. But that wasn't an option. It was like one huge long contraction until he delivered. So I was terrified. I prayed and asked God again to save my son. And sorry. They prepped Justin and I for the OR, which they have a little room off of the OR. So they have a little room off of the OR. They call it the nest, and that's where they prepare all the preemie babies and get them hooked up and put them in incubators before they're ready to be transferred down to the NICU. And everything happened so fast, it was like a blur, so I don't really remember all the little details. But I know they went from having like one nurse and one doctor to having probably 3 or 4 nurses to 2 or 3 doctors in the room, like immediately. And they were getting us ready for the delivery. And I do remember looking over and watching 2 or 3 nurses trying to get my husband dressed in these very tiny sterile pants. And as you see, my husband, he's like a big burly guy. So it was pretty funny to watch, and I wish I could have gotten a picture thinking back now. But they started to take me down to the OR, and on the way down to the room, I was like, oh, I have to push. I had the feeling that I was gonna deliver right then. And they told me, no way. They were like, you better not. You have to wait until we get in that room. So I did my best. I waited. We finally got in the room after what felt like forever. And they told me I still couldn't push because Justin wasn't in the room yet. And that also felt like an eternity while I waited. So then finally, they said, okay now, because he was in the room. One push and Charlie was out and all my pain and discomfort was gone instantly. I cried some more, go figure, I was just crying all the time. And I didn't know what was going to happen from there, but I trusted in God and His plan, and I prayed it was a plan that I would like. So after delivery, a few doctors came up to me, and they started to calm me, and they were like brushing my hair back and talking really softly to me, which I felt made me like almost like a zombie. I stopped crying, but I was just very like what just happened? But they said something really amazing happened. My son was born completely intact, in his sac, intact, sorry. but she said it's very rare. And I looked up the statistics, and 1 in 80,000 births, babies are born en caul, they call it, completely in their sacs. And that's full-term births. It's even more rare in preemie births. She said most doctors will go their entire careers and never get to see it. Justin got to see it. He said he looked like a little doll, just in a water balloon. We didn't have time, or nobody thought to take a picture, which is a big bummer because I would have loved to see it. But they said it was really cool. And we knew that he was special right away, just from that alone. So the doctors asked me if I had a name, and we had not, because my husband is very picky when it comes to names, and he refuses to talk about it until the baby's about to be here. So I had a few names in mind, and luckily my husband looked at me and he said, no, you just kind of went through a lot of rough stuff. I'll let you go ahead and pick the name. So I looked at the doctor and said, his name is Charlie, because Charles means warrior, and I knew it was very fitting for my strong but very, very tiny boy. So they took us back to our room. We waited, and I never got to see him, and I didn't know if I'd ever get to see him alive, but I felt at peace, mostly because I'd been up for so long and I was really exhausted, and also because I wasn't in any pain anymore. But I think the main reason was God giving me his peace. And maybe after a half hour or so, 2 doctors came in with smiling faces. And they said, the first thing they asked me was if I had my weeks calculated correctly, which I did. We planned it out. I knew exactly how far along I was. And they told me he was big for a 22-weeker. He was 1 pound, 3 ounces, and 11 inches long. And they got the breathing tube down his throat without any problems, which is a miracle. And they got him all hooked up, everything they needed to, and he was very stable. So we were allowed to go see him, and I was really nervous because I had no idea what to expect, but I was anxious and I really just needed to see him. So they wheeled me down, they put me next to his incubator. This is the first time I got to see him, and he was the smallest baby I had ever seen, but he was moving around in there. He was a really feisty little guy. That's what all the nurses told me. He was wrapped up in this bag to keep him warm, because one of the main concerns with preemies is that they can't keep up their body temperature, so they have to make sure they're nice and warm, and that's why they're in the incubators. So he was in that bag, and his skin was almost see-through. It was like paper thin on him. And everybody was in such disbelief that he was alive, and we were just so relieved, and we thanked God for being with us that night, because it was the scariest and craziest night of our lives. So Charlie was here. We began our NICU journey, and they told us he was born so early because my placenta had detached, and it forced me into labor. They don't know why it happened. It just happens sometimes. There was nothing I could have done differently or anything to stop it. So we were told also that he was the youngest baby who survived at U of M, and that's the youngest baby that he had ever seen. So again, he was super special. Typically, babies stay in the NICU until their due date. So we had about 18 more weeks, if not more, to be there. And we didn't know what kind of complications he would have then or now as he grows, but we were ready for everything because we were just so happy that he was alive. The NICU was our home away from home. Not many people know about the NICU life unless you lived it because you had to. It's an amazing place. I think it's full of the most wonderful nurses you'll ever meet. It's full of the most precious babies you'll ever see. Full of sadness and worry, but full of hope and prayers. And God in his smallest miracles live in the NICU. Being a part of this place, it was such a blessing that I hope none of you ever have to know. But, because it doesn't always give happy endings like mine. But it truly is, it was an amazing place, and I was very thankful that we were at U of M with the best of the best. So now I would like to talk about, here's some more pictures, sorry. So this just kind of show you how small he was. Those are our wedding rings on his feet. And then like this one down here is my hand touching his little foot. So, super tiny. Wow. Oh, nice. I thought that.
No, I got it.
Is that motion sensitive? Thank you. Okay. So if I'm able to look in Charlie's chart, because I work at U of M, so I go in the system and I read it all the time. And they actually have it listed as his problem list. So these are all, just not all of them, but some of the main things that he had to go through when he was there. So I'm just going to go over each one briefly, starting with the IVH, which is intraventricular hemorrhage. Alright, so these are pretty common in preemies. There are 4 grades of severity, which are, they're just brain bleeds. So typically micropreemies like Charlie have between 3 and 4 bleeds on their brains due to how soft their heads are and their underdevelopment. But in Charlie's case, the medical staff was blown away because he had a grade 1 that resolved on his own. Because usually they have to do surgery and intervene and go in that way to get all the bleeds off of their brains. So this is unheard of. All the nurses and the doctors were just, they could not believe that that was all he had. And one of his nurses had a theory that his brain was protected by being born in his sac, and that's why he didn't have the typical number of bleeds. So that was awesome, like another miracle. And then I included some pictures of Charlie and the Billy lights. So these are for when babies have jaundice, which is pretty typical. But we noticed a very specific shape in the lights, if you can see it right here. It looks like a cross. So we weren't sure if that's how they were made, like if they just had a certain pattern or something like that. And we brought it up to one of the nurses, and we just asked her like if that's how all the lights were, and she said no. She had never seen anything like that before. There should not be any breaks in the patterns or any like of the lights that were out on purpose or anything. So we thought that was pretty special. It was clear to us that everything was designed to benefit Charlie, and it was a nice visual and reminder from God, that He was with us through this whole experience. So, let's go to the next slide. Okay, so as I mentioned before, Charlie had a breathing tube and he was on different respiratory support while we were there, which include CPAP and the nasal cannula, and I will get through all of those, but we're going to start with the breathing tube first, which is endotracheal tube. So he started on the conventional vent. I think if you push the next one, there should be pictures. Here we go. So this gave him breaths, but it allowed him to initiate his own breaths if he could, which he wasn't supposed to know how to breathe, so it's understandable, but he did initiate a lot of his own breaths. He would forget sometimes, and that's where the conventional vent would just remind him and give him some breaths as he needed. A few times he had to be put on 2 different ventilators, the conventional vent and the jet. And the jet gave him more like fast, quick breaths, like a lot of them, just to keep his lungs open and aerated. And we knew he wasn't doing well when he was on 2 vents. But he wasn't on them for very long. He was mostly just on the 1. So that was good. But he hated his breathing tube. He was very feisty, and he pulled it out 7 times, which is terrifying because, it can damage his vocal cords because it was going through them to get into his trach. So the more he pulled it out, the more likely he would be to damage them and possibly not talk. And because he couldn't breathe when he took it out. So it was always scary getting that phone call, that he took it out again. But he had this for about 3 months. And let's see. Okay, next, sorry. Okay, in the first month, Charlie had what is known as a PDA, which is patent ductus arteriosus. Basically, it's an open duct in the heart that's open while the baby is still in utero. And it closes naturally by birth. Like once the baby is born, and it basically is open so that the blood can flow between just the heart and the lungs, back and forth. It doesn't go through the whole body because when they're still in their mom, they don't need to because the mom's supplying everything else they need. So because his was open, blood didn't reach the rest of his body, so he couldn't grow. He was kind of stuck in this small little phase. So there were some options for treatment. They said we could do ibuprofen, can close it, which is amazing, and that's actually why you're not supposed to take ibuprofen when you're pregnant, because it can close that duct. They could do the ligation, which is the surgery where they put a clamp on the duct itself, or sometimes it will close on its own. So unfortunately, Charlie had been on so many antibiotics and kidney filtered medications that he wasn't able to take the ibuprofen. So they had to actually go in and do the ligation and use the clamp to close it. I don't even know how they would work on a heart that small, but luckily they were able to do it. They had no complications. He was the same as his birth weight when he had it done, so he was only 1 pound, 3 ounces, and his skin was still pretty paper thin. But it had to be done. We trusted him that everything will be all right. They did the surgery in his room, and they were able to close it. And they say a lot of times babies get sicker before they get better once it's closed because they're not used to that extra blood flowing through their body. So we prepared for ourselves for some really bad days ahead. But God had other plans. Charlie got better overnight, which was wonderful. Another miracle to witness. So he had a surgery done January 17th, and this was his incision. This was actually when he was 2 months old. I didn't get a picture of him when he first had it done because they had a bandage over him that we couldn't take off. So he's a little bit bigger in this picture, and he looks a lot better too than he did. Alright. So after Charlie's surgery, he was more stable than he was previously. And the day I was waiting for finally came. Oh, sorry. This was when he was a month old. I should have looked up. Sorry. Okay. So this is a little octopus my friend had made for Charlie, and they say some hospitals will let you keep it in with the babies, so they grab the tentacles and not all their cords on the tubes, which would have been helpful for him, but they didn't want him to have it in his incubator, because he pulled his tube out so many times. It would have been nice. Oh, sorry, Charlie. So this is the octopus. As you can see, it's about the same size he was. So this is how small he was. Yeah. He was very, very tiny. Actually, I brought a bunch of goodies. If you guys want to see, I'll even pass them around if you want. Just to show you guys how small he was. This is called a nano preemie diaper, and this was big on him. This is the smallest size that Pampers make. This was his first blood pressure cuff, which was also really big on him. All this stuff is just junk. And then the nurses did this special process where they gave us this footprint. So that was when he was first born. It was very small. Do you guys want me to pass him around? Is that something you guys would like to see? If not, I can just leave it up here. Whatever you guys want. Okay. So every month I did what I call octopics, just to show his growth. So you'll see some more coming up. But okay. So, as I was saying, it was the day I had been waiting for. It was 31 days before I got to hold my son for the first time. So I had to keep very still because I didn't want to knock his tube out, but I could hold him in just one hand because he was so small. And there is no greater feeling than finally get to hold your child and waiting for so long. before you're able to, and we did skin-to-skin or kangaroo care as they call it. The skin-to-skin contact is so good for a baby and mom that statistically babies do much better when they're able to do this kangaroo care with both parents, mom and dad. And I was fortunate enough to work at the hospital, so I went up to see him constantly on my breaks and after work, and I got off work at 11 p.m. So I would go up there every night, and for a minimum of an hour I would hold him, which was difficult because I was so tired. Luckily the nurses would sit in there with me and help me stay awake. But I did it for him, and I needed it too, and I can say that it strengthened our bond, and the nurses said that they think that's why he did so well, and why he's still here with us. So over the course of his stay, I'll get it. Oh, did I skip one? Did I not do that right? Let me see. Okay, well, I'll do it. He had 20 blood transfusions. Oh, shoot. That's my spot. Oh no, I did skip that. Anyway, we'll go back. Every time he had an infection or prepared for a surgery, they would have to draw his blood and test it. And even a small amount had a huge impact on his very tiny body. So when he was first born, he was getting transfusions daily, and it became less and less the bigger he got. And all of these transfusions made us really grateful for the people who donate blood, because without them, Charlie wouldn't be here. So once he would get a transfusion, he would often get very puffy and swollen from all the extra fluid. So he needed Lasix, which is a diuretic, to help get all that excess fluid off. And sorry, I did skip my notes. So Charlie had this when he was 2 months old. It's necrotizing enterocolitis. This is a disease that affects the tissues in the intestines and causes them to die. 20 to 40% of the time, babies need to have surgeries to remove all the dead tissues. And we were fortunate enough that Charlie didn't have to have surgery. He was treated with antibiotics, and his case wasn't that severe. But there is a 50% mortality rate with babies who are diagnosed with NEC, and it's another miracle that he overcame. So, and you can see that's why his belly is pretty big. Their bellies get really distended and have like a bluish tint on them. And then once he was treated, you know, his belly went back to normal. And this is when he was 2 months old, so there's that other octopus. So he's still about the same size. He didn't grow too much within those months. Okay, you can go ahead. Oh, next. Okay, so that leads us to AKI, or acute kidney injury. From being on so many antibiotics and kidney-filtered medications, Charlie's kidneys were failing. This is why they had to have surgery for the PDA instead of using the ibuprofen like I had mentioned before. His kidneys couldn't handle any other damage, so he was on antibiotics from skin infections. They also gave him antibiotics when he was born just as a precaution, and also from the neck he had to be on those antibiotics. He was also on blood pressure medications that could mess with his kidneys. And because of the Lasix, sorry, that diuretic. So his kidneys recovered on their own, but he has issues now that he's older. They discovered that he was getting some calcium deposits and buildup in his kidneys that turned into stones. So when he was 6 months old, he was diagnosed with kidney stones, which is the nephrolithiasis. So now his diet is controlled by the nephrology department. He needs more fluids to flush his kidneys without all the calories, so I have to make his formula with a special recipe. Recently he had an ultrasound done on his kidneys and they didn't see any more stones. He just had some calcium buildup though still, but we're headed in the right direction, so that's always a good thing. Let's see. Okay. As he grew stronger, he was able to go on CPAP, which is continuous positive airway pressure. We tried 3 times to put him on CPAP before he was able to stay on it because he had to breathe and initiate all his breaths on his own when he was on CPAP. He didn't have the musculature to breathe on his own when he was much smaller, so as he got bigger we tried again and it stuck. So he hated the tube down his throat. He liked this better for a while, but then he really hated this, obviously, because they had a little mask. I don't think I have pictures. No. So that little mask over his nose, but they also had prongs which just stuck right up his nose, and this forces a ton of pressure in his nose, and so he would get very, very angry, which I don't blame him. I would too. So he was on that for a while. There's another Octopic, the 3 months old. And eventually, we got to move to the nasal cannula. We loved this because we got to see his face. And he went from high flow, which has more pressure in the cannula, to low flow. And then off the wall oxygen, which is like an oxygen tank. Yeah, and one of my good friends is a photographer, and she did this Harry Potter picture for me, where it's the first chapter, The Boy Who Lived, and it was really fitting, so that's a special picture of me. Yep, oh, and here's another Octopic where he's 4 months old, and this was his due date. Due dates are dumb. All right. So the next ailment that Charlie had is called retinopathy of prematurity. Basically, when he was born, he was so early that his eyes weren't done developing, obviously. His eyelids were actually fused when he was born, and they didn't open for 2 weeks. As he got older, his eyes were still developing, and the blood vessels in the eyes began to grow abnormally. This is why ROP, as they call it, could lead to detached retinas and therefore blindness. So it was pretty serious. We wanted to get on it right away. The doctor said we could treat with what's called Avastin injections. There wasn't a lot of data on them because they're a newer treatment for the eyes. Sorry. You're okay. But they said they were hoping to do the injections so that the blood vessels would regress on their own, and then therefore be able to grow normally from there. Otherwise, they would have to do the laser surgery right away, and that would have cut off all of his peripheral vision. So they asked us what we wanted to do, and we thought about it and said we wanted to try the injections first and see if they worked, and luckily they did. So he went from, there are 4 stages to ROP. He had stage 3 in both eyes. Plus disease is where it's more severe, I guess. So his right eye was worse than his left. And after he got the injections, he went down to stage 0. So they worked very well. And then in July, he had the laser surgery just to burn off any extra stragglers. And we recently went to the ophthalmologist. They said his eyes look great. He will need glasses in the future because he is pretty nearsighted. But we'll take it. That's much better than blindness. So wonderful news all around. Okay. When Charlie, do you want me to take him? You sure? Okay. When Charlie was put on the nasal cannula, he was able to try eating for the first time when he was 5 months old. It was a very slow process to get him to eat because he used to suck on his breathing tube, which is kind of weird. And he liked a pacifier, but he never had any fluid actually dripping down his throat. So he didn't know what to do. He didn't know what to think of it when we first gave it to him. But we kept working on it, and we knew it was going to take a lot of time. The nurses said this is the most frustrating part of the NICU, is just getting the babies to eat. Because most babies are born with that instinct to suck and to drink milk, but he lost it. So we had to start over fresh and just teach it to him. So it was a very long process. It was frustrating. So almost 6 months old, 173 days in the NICU. Charlie got to leave his room for the first time. All of his procedures and surgeries, everything was done in his room. And he was never well enough respiratory-wise to be able to leave the room, to be unhooked from everything. But once he was on wall oxygen, we could hook him up to the tank and go for a little stroll around the unit. So it seems silly, but it was such a big deal that he got to leave his room for the first time. And it was a big step toward going home. So here is 6 months old and 7 months old. At this point, we were just working on feeding, breathing, and growing. So there really wasn't much else we could do. We're still trying to teach him to take the bottle, and he had to come down on his respiratory support. So yeah, he's much bigger now in these pictures than when he first started. Let's see. So we did try with the bottle to give him more consistency because he started to eat less. And he would do these defense mechanisms to get the bottle out of his mouth. Like he would bite down on the nipple, he'd put his tongue up, he did not want anything to do with it. So they were also increasing the amount of milk he was getting because they were flushing out his kidneys, and he couldn't keep up trying to take more while they're like keep increasing his volume. So then he developed what's called oral aversion. He had so many negative things happen to his mouth with the breathing tube. He has another tube which is, I think it's in his nose in this picture, this orange one, that's called an NG tube. That's how he was getting his milk the whole time. They would put it down his throat, and then they eventually could put it in his nose when his nose got a little bigger. So he didn't like having that in his mouth, so that aided to the oral aversion. And after weeks of trying to adjust with the consistency and everything, we decided it was best to get what's called a G tube, which is a gastrostomy tube. So they had to do surgery, which is the same day he got his laser eye surgery, so that was a really big day for him. They just put this little button in there. It's called a Mickey button. And then that's how we feed him now, and he still has it. And you can also just give him the medications right through the tube, so he never has to have anything in his mouth, which is nice for medication-wise. We still are able to work on feeding. I do baby foods with him twice a day. He doesn't like it, but we're working on it. I tried to do a bottle and I stopped because it was too frustrating for him and it wasn't worth it. They told me it wasn't a big deal. Some babies just don't ever take a bottle. So he was still getting everything just through his little button. And if we didn't get it, we would probably still be there at the hospital. So we were able to take him home. We had to learn and do like little classes about the G-tube, which was really intimidating at first, but now it's nothing. It's really easy, which is nice. So after his surgery, he was off all respiratory support. I walked in right before work one day and I came in and he had nothing on his face and I cried because I couldn't believe how cute his little face was. It was really just so bare and naked and adorable. And he had come so far from being on the vent to having nothing, and I was so proud of him. A short time after that, it was finally our time to go home, and Charlie was discharged after 216 days in the NICU. It was a joyous day, and after being there for so long, Charlie had become a favorite among the staff. Not because he's so incredibly handsome, but because he was so happy and easy. Usually the very sick and chronic babies, they say, are really grumpy because they go through so much, but not Charlie. He was just sweet and happy, and everybody was happy, but very sad to see us go because we had formed friendships with a lot of the staff. Oh, So here's some more pictures since we brought him home. So there's 8, 9, and 10. 10 was pretty recently. That was this month. What's next? Oh, and here are my boys. Theo and Charlie. They love each other. Very sweet. Because I held him every night, as I said, I became very close with the nurses, and they were able to talk to me openly. And almost every single one of them told me what a miracle Charlie truly is, which I knew. But they all thought it was really mean that the doctors offered to save him. They said they didn't think it was fair to us to give us that false hope when they knew we would just be watching our son die. They had seen it before, and they knew he didn't stand a chance, but because of that, no one really wanted to take him on as a patient. So we kind of had some trouble getting nurses to actually want to care for him at first. After a while, they were fighting over him because everybody loved him so much. But they didn't want us to watch us grieve and to watch our son pass away. So in a way, they were guarding their own hearts, which I understand. But they were just really wrong, which is nice. Because they didn't know that God had other plans for him. So he's really special to everybody. I don't know how many people have been touched by Charlie's story. I know a ton of people prayed for him and for our family, but I couldn't even guess a number. Our friends and families have been extremely supportive. We wouldn't have made it through without them or without our faith. There were a lot of very long and hard nights over those 7 months, and I knew God was in control, and He had brought Charlie this far. No, you're okay. He had brought Charlie this far, and I knew He wouldn't fail him, because He obviously had very big plans for him. So I trusted Him, and I would constantly tell myself that over and over again, because there were a lot of times where I was just really sad because I wanted him home. So we're adjusting to life at home. We love having him, and it can be very challenging at times. We have tons of appointments. He sees a lot of different specialists, and the G-tube care can be very tedious and time-consuming, but we wouldn't have it any other way. And we're also trying to be extra careful when it comes to his health. His immune system is what they call compromised because he was so early. It's not strong, so what could be just a small cold to you or I would be a hospital stay for him. So we use lots of hand sanitizer. We keep anyone who is sick far away from him. So we're cautious, but we're super, super happy. So I called this, the focus series is chaos, so I called this organized chaos because for me it was really chaotic and scary at the time, but in hindsight, everything happened like it was supposed to, and there was a clear design put in place. And I don't know how anybody could hear of Charlie's story or know him or see him and not believe that. So when medical professionals said no, God said yes. The experience was difficult at times, but I'm blessed to be a part of it because I got to witness that God is still in the miracle-making business every single day. So here is Charlie. I was hoping to make him like a more of a grand entrance, but here he is. Super cute. You guys are welcome if you want to come up and say hi to him. I will ask that you don't touch him just because of his immune system. Or if you're sick, maybe kind of stay away a little bit. I'm also happy to answer questions, but I just want to thank all of you guys for coming out here today and hearing our story. And thanks for SAU for having us as well.